Well, Parkinson's disease and Huntington's could also both be treated with this gene silencing medicine. We can talk now to Cath Stanley, who's the Chief Executive of Huntington's Disease Association, is with me in the studio. Thank you very much for joining us.
Thank you.
So it's currently only being used to reverse amyloidosis. Why not Huntington's at the moment?
So there was an initial safety trial for Huntington's disease which did show that it lowered the Huntington protein, and they're currently recruiting for a big trial to make sure that it is safe and effective and does actually lower the Huntington protein.
These are rare diseases. Just tell us more about Huntington and what it does.
So Huntington's is a very rare disease. There's about 8,000 people in the UK with the illness, and for every one of those people who have the illness, there are 4 people who are at risk from inheriting it. If you inherit the gene, you will go on and develop symptoms. Symptoms of the illness usually occur between the ages of 30 and 50. They begin quite insidiously and then progress. So people have problems with thinking, cognitive problems. They have problems with the motor disorder, so have involuntary movements, and they have behavioural and mental health problems.
And so this gene silencing therapy could be absolutely transformational for patients. I mean, what could it do? What would your hope be?
So the plan would be that it would either delay the onset of symptoms so that people could live longer without the symptoms of Huntington's, or ultimately actually never develop the illness at all. So it's a real hope for people.
And how long would you expect the process to take while they assess how effective it can be for Huntington's? And is there any reason to expect that it shouldn't work for Huntington's when it is working for amyloidosis?
There is no reason. I think certainly researchers are very optimistic. I think realistically, in terms of a treatment for Huntington's, we're probably talking at least 5 years away for the trial to carry out and then for it to go through all the drug approval process.
Currently, what treatment is there for Huntington's?
So there's a treatment for symptoms, there's treatment for mental health symptoms, there's treatment for the movement disorder. There's very little treatment for the kind of thinking, cognitive. So people have a cocktail of drugs that can help with symptoms, but doesn't actually change the process of the illness.
And this obviously would be, if it were to come through in 5 years potentially, it would be something, as you say, that would be used hopefully prior to symptoms becoming obvious. And would somebody would people know if they have the gene? I mean, how would that be
so
managed?
You can have what's called a predictive test that will tell you whether or not you carry the gene. At this moment in time, the majority of people at risk of Huntington's choose not to have that because it doesn't change the fact that they will get the illness. But obviously, if there was prospect of treatment, that would change dramatically.
Yeah, absolutely. Thank you so much for coming in and talking to us.
Thank you.